Hello, my friends. It's me again, Rizky. Do you remember about this picture? This picture is from a movie called Split. In the last meeting, we have discussed about the ID or dissociative identity disorder. Now, I will inform more about this disease to you. Start from what is the definition of dissociative identity disorder? According to Thomas F. Ottmans and Robert E. Emery, explain that the ID is a disorder characterized by the presence of two or more personalities that exist within an individual. The original personality is likely to experience amnesia for subsequent personalities who may or may not be aware of the other alters. Other experts like Sedek and Greb explain that individuals with this disorder have two or more different personalities. The behavior and attitude shown by the individual are very dependent on which personality is the most dominant at the time and differ from one personality to another. From those definitions, we can conclude that the ID or dissociative identity disorder is rare condition in which two or more identities or personalities are present in an individual and take control of an individual itself. The primary identities carry that individual's given name and is passive, guilty, dependent, and depressed. When in control, each personality state or alter may be experienced as if it has a distinct history or identity. The alter's characteristics, including name, gender, vocabulary, knowledge, age, and also mood, are contrast with those of the primary identity. Now we move to causes of the ID or dissociative identity disorder. The ID caused by trauma that experienced by the patient. The trauma often involves severe emotional, physical, and or sexual abuse. It means the history of trauma is a feature of the ID. About 90% of the cases of the ID have some history of abuse in their childhood. The trauma often involves severe emotional, physical, and or sexual abuse. It might also be linked to accident, natural disaster, and war. Next is symptoms. The symptoms of the ID. The ID shares many psychological symptoms as those found in other mental disorders, including changing levels of functioning from highly effective to disturbed or disabled, severe headaches, or pain in other parts of the body. Depersonalization, it means feeling disconnected from one's own thoughts, feelings, and body. Derealization, it means feeling that the surrounding environment is foreign, odd, or unreal. Depression or mood swings, anxiety, eating and sleeping disturbances, problems with functioning sexuality, substance abuse, amnesia, it means memory loss or feeling at time distortions, hallucination, it means false perception or sensory experiences, such as hearing voices, self-injurious behavior, such as cutting, and the last one is suicide risk. 70% of people with ID have attempted suicide. Now we move to treatment. The goal of treatment for the ID is to relieve symptoms, ensure the safety of the individual and those around him or her, and connect the different personalities into one integrated or well-functioning identity. Treatment also aims to help persons safely express and process painful memories, develop new coping skills and life skills, restore optimal functioning, and improve relationships. The best treatment approach depends on the individual and the severity of the symptoms. Most likely treatment will include some combination of the following methods. The first one is psychotherapy, sometimes called talk therapy. Psychotherapy is the main treatment of the ID. This is a broad term that includes several forms of therapy. Next, cognitive behavioral therapy. This form of psychotherapy focuses on changing dysfunctional thinking patterns, feelings, and behaviors. Next, eye movement desensitization and reprocessing EMDR. This technique was designed to treat people with persistent nightmare, flashbacks, and other symptoms of post-traumatic stress disorder. Next one is dialectic behavior therapy, or DBT. A form of psychotherapy for people with several personality disturbances, which can include dissociative symptoms that often occur after an experience of abuse or trauma. Then family therapy. This helps teach the family about the disorder as well as helping family members recognize symptoms of a recurrence. And creative therapies, for example, art therapy and music therapy. These therapies allow patients to explore and express their thoughts, feelings, and experiences in a safe and creative environment. Next is meditation and relaxation techniques. This helps people to better tolerate their dissociative symptoms and become more aware of their internal states. Next is clinical hypnosis, a treatment method that uses intense relaxation, concentration, and focus attention to achieve an altered state of consciousness, allowing people to explore thoughts, feelings, and memories they may have hidden from their conscious minds. And the last one is medication. Actually, there is no medication to treat the ID. However, people with the ID, especially those with associated depression and anxiety, may benefit from treatment with antidepressant or anti-anxiety medication. I think that's all about the information of dissociative identity disorder, or the ID. See you next time.